All right, so let's talk about this recently published trial in JAMA, Intervention to Promote Communication about Goals of Care for Hospitalized Patients with Serious Illness, a randomized clinical trial. Stay tuned to the end where I'll let you know how this has influenced my practice. I'm Mike Freilich, a general internist, work in Toronto and Sault Ste. Marie. So let's understand the sort of nuts and bolts of the study. So I used the PICOT approach, so population. They included hospitalized older adults, especially those with serious illness. The intervention was this goals of care discussion guide, which I'll show you what that is shortly. Comparator was usual care, so just whatever doctors typically did when they're getting a goals of care conversation done with a patient. Outcome was documented goals of care discussions. So did this intervention actually lead to more goals of care conversations occurring and that being documented in the electronic medical record? And they used a time horizon of 30 days. Was this placebo controlled? No, for obvious reasons. How is it funded? Mainly from government and nonprofit. Outcome clinically relevant? I would say yes. It's important to have these goals documented and the conversations to be had. Was it blinded? No, for obvious reasons. Intention to treat? Yes. And a relatively small 3-center study. Let's look at what on earth this goals of care discussion guide was. So this was just a prompt informing the sort of clinician about why their patient was eligible for the study, and it provided them with their advanced directives, if they had a POA, etc. And then the actual guide itself, you can pause the screen if you want to spend some more time on it. But the idea was you'd start by introducing yourself to the patient, give yourself 5 to 10 minutes, and really let them know it's a part of routine care. So such as, I want to know what's important to you so that we provide the best care to fit your goals. Is that okay, right? Opening the conversation in that way. And then you can pick whatever sort of topics you felt were best, whether you want to talk about understanding, their current sort of status and what are their values, right? So if you were to get sicker, what would be most important to you? So this is what this looked like in the intervention group. In terms of the results, so screened just under 4,000 patients, 2,500 were randomized, loss to follow-up was rare. Baseline characteristics, so average age of 70, 40% were women, 33% were of a minority group, limited English proficiency in 14% of patients, and a designated power of attorney prior to discussion was present about 13%. So what did they find for their primary outcome? So you can tell that in the intervention group, there was more likely for this EHR documented goals of care conversation to be had and in the chart. So, 35% versus 30%, so a 4% absolute difference or absolute increase. And I think this is important. I think this is still meaningful. I'll note up front, they also looked at sort of hard clinical endpoints. How did this affect sort of subsequent ICU utilization, healthcare utilization in general, and no difference between the two groups. And then they also found that among individuals who were not white, even higher rates of these conversations being had and documented. Some important limitations. So, you need a larger study to really analyze the hard clinical endpoints, right? It's important to document these conversations, but how does it then lead to healthcare utilization at the end of life? That's an important unknown. And of course, the study wasn't powered for subgroup analyses. They're predominantly just exploratory. So overall, a clinician-facing communication priming intervention significantly improved documentation of goals of care discussions among hospitalized older adults with serious illness. Thank you to Natasha Verhoef for producing this video. And I'll end with the slide on this discussion guide if you want to look at it closer. Thanks so much. Have a great day.